let's investigate the connection between your advertising and your content. There's often a bit of confusion about the role of these two tactics and how they can work together. So let's clarify that with a few interesting examples and take a closer look at what happens when we do a Google search for, let's say, weight loss surgery, and we're after a solution, obesity surgery, let's say in Sydney. The ad is one part of the story. That's where the first decision is made by the patient who is now doing a Google search. So you've got a very captive audience here. They've expressed their search intent, and your ad makes a difference, obviously, what they'll click on. And there's techniques to make your ad more compelling or not. And then once the patient clicks on the ad, what happens? Do they just get some information that allows them to read and go through it and then decide what to do? Or are they drawn in by a smart mechanism that combines the copy, the visuals, some call to actions, some actions they can take by entering the details and starting a conversation. So that makes a big difference. It's no longer just about the ad, it's about the quality of the conversation and what happens after the patient clicks on that ad. Now, there's another way to do this, which is not to depend on Google Ads, but to depend on your organic content. If there's not a lot of heavy competition for a specific keyword in your area, then the other strategy is to build quality content that patients land on because it ranks really well, and the trust and rapport that comes from this way of communicating is huge. Really, the highest level of conversions happen when your content does the heavy lifting for you. So you're no longer looking at ads, and patients are no longer convinced by smart, sales-oriented copy. What happens here is a real conversation with an expert, because your information works for you, represents you as the patient is doing an online search. And you can take this to the next level by putting in place amazing, awesome content. By the way, we built this content with our customer here at Digital Practice, putting in place amazing content about the topics that the patients are Googling for, presenting the information in a palatable way, using the power of imagery and video, and making sure that as a patient, I get drawn in. It becomes an experience, and the currency is trust and rapport. So think further than just advertising on Google as a doctor, and think about the outcome that you're after. It's that relationship of trust and rapport, and the conversion of a click and a visitor into a new patient. If that resonates with you, let's do a strategy session and discuss your practice growth.